This is something that's commonly experienced by providers or observed by providers, but maybe not necessarily a name given to it. So, how many are familiar with the term expressed emotion? Yeah. Okay. Perfect. Well, today we'll talk a bit about how to define expressed emotion. What is it when I say high expressed emotion? Its impact that it can have on family systems and also on your work with, your patients and your clients. And then we'll talk about the importance of really kind of recognizing if this is occurring and how to address it with families and why it's important to address it. So, expressed emotion is really how loved ones express their feelings and attitudes towards somebody that's living with a mental health condition. So, high expressed emotion is really undesirable. And that's what we'll talk a lot about today. But that's when feelings and emotions are expressed by an individual's loved ones in negative and unhelpful ways. And this is unfortunately a pretty common pitfall, something we commonly see in family systems when one member of the system has a serious mental health condition. So, high expressed emotion, when you think about it, it really involves a lot of critical comments being made to that individual, hostility. So, somebody might appear angry or aggressive or irritated with that individual. And then this other aspect of emotional over involvement. And, think of that like somebody is excessively self sacrificing, really that caregiver burnout, or being overprotective to the point where it's interfering with the individual's autonomy. So, some other ways that you might observe or hear about high expressed emotion are insults, somebody appearing not very empathic or understanding, some frustration, appearing quick to be annoyed, a little bit of resentment towards the individual for their condition, their situation, the impact it's had on their family, blame, sarcasm, shame, aggression, all of these kinds of things. So when you observe, this pattern of behaviors or expression, emotional expression towards an individual, you can think of that as high expressed emotion. So, how many have maybe experienced or observed expressed emotion is pretty common, even though it hasn't had that label or the name attached. So, interactions between family members when there is high level of expressed emotion, these are interactions that are pretty rigid. They're often tense and sometimes emotionally intense, and it feels oppositional. So it feels like really these family members are working against each other. Individuals with cognitive vulnerabilities, including those with serious mental health conditions, are really impacted differently than the normative population because of how they process and subsequently internalize these kinds of critical comments that come along with high expressed emotion. And so, obviously, this can contribute to the level of distress or stress that somebody is experiencing when they're already symptomatic. So home environments that are really high in this idea of expressed emotion lead to high levels of symptom relapse, which given what that sort of picture of what's going on within the family system, it's not too surprising. So if an individual is perceived as feeling or is perceiving their loved one's attitudes towards them as negative, unaccepting, unsupportive, unloving, we can see why high expressed emotions are leading to symptom relapse. One source cited up to 95% increased likelihood of a symptom relapse for somebody who is steeped in this kind of family environment. Following an acute episode, a psychiatric episode, discharge from hospitalization, individuals that go home to an environment where there's level high expressed emotion are 2 to 3 more times more likely to come right back to the hospital because of return of symptoms within the first 9 months of discharge. So it's clearly something that's impacting these individuals with serious mental health conditions with whom we work. So it's not a sudden occurrence. It's not something that just develops overnight within a family system. It really develops over time. And some factors that contribute to that are an individual's personal history or events, each family member's personal history or experiences, family systems shared histories and experiences, if there's any kind of shared trauma, shared stressors, personal variables and attributes of every person in the system, what the illness is attributed to, how it's interpreted or understood by each person in the family system, including the individual, various relationship factors. So all of these kinds of things that are a slow build to this kind of family environment or system environment that can be really unhealthy for individuals with whom we work. So oftentimes expressed emotions, a high expressed emotion occurs because of how the serious mental health condition is attributed. So their symptoms or their behaviors that maybe are undesirable or stressful are being attributed to that individual's character flaw. It's a character flaw with that person. It's intentional or volitional that they're engaging in these undesirable behaviors. It's a sign of weakness. And so, a common one that you may think of is somebody just won't get out of bed because they're lazy. It's not recognized as being a negative symptom of schizophrenia, for example. But high expressed emotion, it may really be an indicator of this family system's interactional styles. But it's not always due to negative attitudes about mental health or mental health conditions. Sometimes it's because of a lack of understanding about the mental health condition or what its impact is on the individual, how it's impacting the system. Also, oftentimes loved ones are really responding from a place of fear for the family system's future, for that individual's future. And so it can oftentimes appear that loved ones don't care about that individual. They have contempt for that individual. Sometimes they appear confrontational in how they're expressing their concerns, but really it may be just their own anxieties and ineffective communication strategies, especially when they're under stress, that are leading to some of these interactions that people are having within the family system. So loved ones that are high in expressed emotion obviously display more negative behaviors when they're interacting directly with that person as compared to other family members. And this occurs, interestingly, often during problem-focused discussions. And I think that's because there's a level of frustration. They feel that there's a lack of commitment, that there's a lack of change or a lack of motivation. And so when we're working with family systems who we know to be high in expressed emotion, commonly things that we do with these family systems are to work on coping skills and stress management, working through problem solving, since we know that this is an area point of contention, but it's such an important one that family systems need to learn how to work through together. Other inventions, psychoeducation, what is this illness? What do symptoms look like? What is this idea of a negative symptom or a cognitive symptom? I've only heard of hallucinations and delusions. And also communication skills is another area that is commonly addressed with families that are high in expressed emotion. And thinking of communication skill building, the goal is to really reduce these levels of expressed emotions by learning how to negotiate and talk with one another, but also importantly, listening effectively to one another. Other things that, are helpful to explore for high expressed emotion family systems are, how did that expressed emotion, level of expressed emotion develop within that particular family system? How does each person within that system process and respond to negative affect, critical comments by their loved ones? How reactive is each person in that family system? How do they respond? How skillful are they in responding or navigating these kinds of difficult interactions? Do they respond, in kind, and they respond very negatively, which just increases that back and forth and level of resentment and frustration? And also, what's the level of self-awareness as to their behaviors when somebody is high in expressed emotion? And does the individual that is on the receiving end of that high expressed emotion, is there any contributing factors that they know that the individual it might provoke negative attitudes for those around them? So, if I know that if I roll my eyes, it really gets under my dad's skin, is that something that I engage in? And that in turn results in higher levels of expressed emotion over time with my father in that interaction. So it's just important to recognize that expressed emotion may be occurring in the family systems of people with whom you work. And so really sort of assessing for it and addressing it as early on as possible is important. So thinking about how does the individual view their family, the individual with whom we work, how do they view their family dynamics? What's the family's understanding of the mental health condition? What's the quality of the family's interactions? What does that look like, and especially in times of stress? How do families communicate? What is their communication style? What is their coping style? How do they manage stress? And this is really trying to get a snapshot of each individual with whom you work. There are assessment tools available that I've listed here. The Camberwell is a great one. It's sort of the gold standard for assessing expressed emotion, but it does require training and it can be pretty time consuming. So there are other options. I personally like the Family Attitude Scale. There's some information there about where to find that. But, in your work moving forward, I think we all have observed high levels of expressed emotion in the family systems of those with whom we work. But thinking about, the personal history and experiences of that individual and those individuals in the system, the bidirectionality of relationships within a family system. And so, if family members are responding harshly or they're being critical of someone, it's possible that the individual with whom you work may also have these sort of negative attitudes, negative emotions, negative responses as well that are feeding into the cycle. And also considering cultural differences and how family systems may express emotion, because this impacts not only how we interpret high expressed emotion, but how we understand its relationship to that person's, clinical outcomes, and how, their pathway to recovery. So, just food for thought, thinking, have you observed this in your practice? How might it be impacting your work? Even if you don't work with that family system often or at all, how can high levels of expressed emotion still possibly be impacting your work? And, thinking about in the system or the practice in which you work, if you do observe expressed emotion, or if it's suspected, or just based on, listening to the individual with whom you work, are they describing this kind of family system? What might you do to intervene? So this PowerPoint is already uploaded into iEcho, so you have this available. And also, you can feel free to reach out to me anytime if you want to talk about anything related to family. So thanks for your time.